Howdy y'all, and welcome to AIM for Mobility here on KidPass, your free monthly introduction to elementally intuitive movement, a 6-level program of intuitive functional movement developed by me, Mar, a massage therapist for 17 years up until COVID came along and made me decide to change my direction, plus 15 years of flow arts training, paired with the restrictions that my body places on me specifically. So it has to be gentle, and it has to vary, it has to be fluid. Too much repetition and my body protests, too much pressure and my body protests. So it's a gentle practice, but it's a very functional practice. It teaches our bodies how to approach our spheres with our particular bodies, honoring the biomechanical designs of our bodies that we all share, but also paying attention to our particular dimensions, because every body is different. Our arms, our legs are different lengths, and as we're developing and growing throughout childhood into adolescence into adulthood, our dimensions are going to change. So it's important to know how to adapt to the changes that we're experiencing as we're experiencing them. So AIM gives us the opportunity to practice adapting to change, because we're always changing. Elementally intuitive movement has the same foundation. We follow a structure, we pay attention to certain things, but aside from that, we allow ourselves to move naturally through space in what feels most natural to us. For this particular program, we're going to focus on the first 3 levels of AIM, which is O, 1, and 2. O, our hands are connected. 1, our hands are on our vessels. 2, we're expanding into our spheres. So you can think about it as O, we're making that O with our hands. 1, we are the one. And 2, we have our 2 arms in place that are now our guides that are guiding us. Level O is getting to know our guides, getting to know our guide, which is our hands and our arms. So we're getting familiar with how to follow our hands with our bodies and allow them to guide us through space as we're exploring all the different ways that we can move with our feet firmly planted on the ground, because our base is stationary. So we're moving through our spheres. We're very, very mobile as we're moving through our spheres. But our restriction here for those first 3 levels is that our feet are going to be stationary. We can shift orientation, we can shift the position that we're in, so that way we get a sense for how to explore and approach and access space from this particular foot orientation versus this particular foot orientation versus this particular one, or this one, or this one, or this one. We can play with the proximity of our feet to each other, apart from each other. But once we get into position, we want to be stationary there. So that way we know that our feet are in a position that best helps support our knees. And what is that? So we want our feet to be lined up with our knees. So our feet basically parallel to each other, maybe just out a little bit. If you're used to having your feet in or having your feet splayed out, then slowly work your way in to center. Or if you're used to going in, work your way out to centered. So that way, the force, what happens when our feet are lined up this way is that our tibias line up with the knee joint in such a way that they're in the best alignment to help distribute the force, the ground reaction force, that's entering into our body with every step that we take, and ensuring that it's even. So that way the meniscus, which is the disc in the knee, or rather the cartilage in the knee, that assists with motion and provides the cushioning, is getting even wear. If our feet are off to one side or into the middle, then the wear is going to be uneven, and then our bodies have to compensate for that uneven force that's being applied as it travels up our bodies. So that's a sphere of awareness that we want to pay attention to. We also want to be aware of hinging at our hips. So what that means is that when we bend, instead of bending at our waist like this, we use the hinge mechanism, the joints of our hip joints, and bend from here so that our backs are maintained straight. And then we also help to support our spines using the muscles in the front of our bodies and our centers, so that we're providing support all the way around. So it's a sphere of attention that we're paying to. As we're practicing AIM, we're mobilizing our bodies, but we're also training ourselves to pay attention to these spheres so that we better help support our bodies according to their biomechanical design. We're also paying attention to how it feels. If it's not comfortable, don't do it like that. Try it a different way. Another important aspect of AIM is breath. As much as possible, we want to inhale through our nostrils because our noses serve as filters, and exhale either through the mouth or through the nostrils. At the end of each exhale, if we pause for a moment or two, it gives us an opportunity to build up more CO2 tolerance. It's carbon dioxide. The more tolerant that we are to carbon dioxide, the more our bodies recognize that we're okay, for one, because we don't need to take breaths very quickly. The less breaths we take per minute, the slower our heart rates are. The slower our heart rates are, the slower our breathing rate is, the more our nervous system perceives that we're calm, that we're safe, and has more resources available for self-repair, for doing other things, basically, for digesting, for resting. So part of what we're doing with AIM is training ourselves to maintain our feet in a position that best supports the alignment of our knees, to maintain ourselves in motion, but as we're moving, to bend at our waist, not at our waist, excuse me, to bend at our hip, using the hip joint mechanism as we're moving, keeping our spine supported and straight. We want the spine to be stacked, so that way the discs in between the spine are also getting even force applied onto them. From above, as gravity is gravitating, we are gravitating towards the earth, so gravity is holding us to itself, and in that process, force is pulling down and the spine starts to get compressed. So by maintaining that even stack on our spines, we help to support that. Now, there's a natural curve in our spines that we're designed to have that also is part of the counterbalance system of our bodies, and we're still working with that. It's just when we're consciously moving our bodies and exercising, we want to maintain that stability because we're training our autopilots to move through space in the most effective and efficient ways according to the biomechanics of our bodies. So we're breathing in through our nostrils slowly because our noses are filters. Also, breathing slowly through our nostrils allows nitric oxide to build up in our nostril cavities, in our nasal cavities. The more nitric oxide builds up in our nasal cavities, the higher the concentration is, the better our nose serves as our first line of defense against bacteria. So that's important. So part of what we're practicing is we're practicing AIM. Not only are we mobilizing our bodies, but we're also training ourselves to breathe in a more effective and efficient way. Support our spines by using all of the muscles in our core. Support our knee joint mechanisms. And getting back to center and breathing, make sure that we're breathing from the diaphragm, that our bellies are expanding out and contracting back in as we take each breath. So that's a lot to think about. Yeah, it's a lot of different spheres of attention that we're paying attention, and that's okay. If it takes time to learn to juggle these different balls that we're going to be juggling as we're practicing AIM. Part of what we're practicing as we practice AIM is recognizing when we've dropped a ball and picking it back up again, and getting in the habit of checking in with what I call these mirror balls, these sphere view mirrors, and checking in with ourselves and where we are. Where are our feet? Are we hinging? Are we supporting our spines from the center? Am I breathing through my nostrils? Rather inhaling, more importantly. Am I using my diaphragm when I'm breathing? All right. So those are things that we're paying attention to, just on a basic level, before we add in any hands or anything. Those are all spheres of attention, spheres of awareness that we're keeping ourselves paying attention to, and ensuring that our spheres are clear, our near spheres with level O, And level low, our hands are connected. And with our hands connected, there's lots of ways that we can explore the connections. We can have them together, palm to palm. We can have them back to back. We can have them fingertip to fingertip. We can twist them. So there's a lot of variations. So even though we're confined to our hands being stuck together, there's a lot that we can do with that. And in so doing, explore motion and being moved by our guides, and maintaining our lower bodies in motion as we're exploring space with these guides. Pay attention to how it feels. If anything feels uncomfortable, don't do that. Do it a different way. There's only so many ways that we can move with our hands connected, so we don't really need to think about what we're going to do so much as just be curious and allow ourselves to explore as we're moving and how it feels. The more slowly we move, the more time we have to think about it, but also the more challenging it is, because the more slowly we're moving, the more we're having to hold ourselves up against gravity. The further away our arms are from our bodies, the more gravity is working to pull us forward. The closer our arms are to us, the more we're stable. You don't have to do what I'm doing. What I'm doing is just examples of ways that you can explore your sphere and move. Your sphere is your sphere. Your body is your body. Part of what we're doing here is giving you the opportunity to practice exploring how it feels moving through your sphere with these particular limitations in place that make it easier for us to focus our explorations. And it gives our bodies, our nervous systems, a sense and feel of what is the best way for us to access space while our feet are put in a position that best supports our knee mechanisms as we're moving through space, and seeing how we can access the space that we can access with our hands connected together. And as we're doing this exploration, checking in with breath, breathing through nostrils, center, holding ourselves up. If we're changing elevation, that we're using our hip hinge mechanism. And really what we're doing, we're exploring planes. So we've got horizontal plane, vertical plane, diagonal planes. So we can choose to explore specific planes and how it feels to follow through those planes and maintain those planes as smoothly, evenly, and steadily as possible. So decide which planes you want to explore. And beyond that, just let your body explore. Pay attention to how it feels. Check in with your feet. Do they need to shift? Check into those different spheres of awareness. Breath, center, hips, knees, feet. Curvilinear motion takes us through all of the different planes. It's more dynamic. but work your way up to it. Explore it slowly. The main goal of EIM is mobilization. As we're moving and exploring our spheres, we're lubricating our joints by producing synovial fluid. We're warming up our muscles and we're warming up the interstitial fluid, ground substance that's in between everything, that holds everything together, that helps carry nutrients through our bodies, and water. Whatever we practice often, we know how to do better. So if we're practicing sitting a lot, then our bodies know how to sit very well. To counter all the sitting that we do in our current society, we need to remind our bodies that they can move. And by exploring our spheres and discovering which ways we can move, we establish more maps of motion, so that we know what we can do. We also recognize, as we're exploring, that which feels uncomfortable. And if it feels uncomfortable, then we know to avoid that and not do that. So we learn what we don't want to do, what we don't prefer to do. So that's level O, with our hands connected. Now level 1. Our hands are connected still, but to our bodies. So now as we're exploring, we are finding our centers. In finding our centers, we're getting a better sense of proprioception. Proprioception is where our bodies are in space. As we are exploring our centers with our hands, we're getting a sense for exactly that, where our bodies are. We're feeling, we're stretching as we're accessing our bodies. We can add pressure and use this as an opportunity to practice self-massage. And we're still maintaining that motion, that constant motion that I talked about, that's a sphere of awareness, to keep ourselves moving gently. Even though our feet, our bases are still stationary bases. We can change orientation if we need to, or stay grounded in the same space. Either way, it's fine. We can let one hand go and stretch it out. As long as one hand is still connected to the body, it's fine. So there's a lot of different ways that we can explore our sphere, and this, as we are exploring and going down, we are definitely going to want to ensure that we're hinging at our hips to keep our spines protected, maintain that stack. We can do hands free, but maintain the contact with our arms and explore what it's like to find our centers with our arms instead of our hands. And how does that guide our motions as we move? We're still getting the primary aim of EIM, which is mobilization, warming up our tissues, mobilizing our joints, and getting a sense of how to move through space. You can mix in level O with your level 1. If we apply pressure in and just hold it in and motion, then we do some self-massage. We do something very similar to an active release technique, where we're pinning the muscle down with our hands, and then we're stretching it with active movement. And you can go lightly, you can apply more pressure, it's up to you. Everybody is different. If you notice something along the way that feels like it needs attention, give it attention. If you happen to have a massage therapist, physical therapist, somebody that can help you with whatever you recognize or feel is coming along in your body, now you can better communicate that to them. Or your parents, if you feel some discomfort in your body, tell them, oh, it hurts here. Sometimes we don't know what's going on until we check in with ourselves. So that's what level 1 is. We're finding our centers, we're checking in with ourselves, we're supporting our sense of proprioception so we know where we are in space. We're sensitizing and stimulating our cutaneous nerves. And we can take this as an opportunity to say thank you to our bodies for carrying us, for holding us as the conscious navigators that we are within our vessels, so that we can experience life on this planet in these spaceships that we're learning to take care of with elementally intuitive movement. So that's 1. Now, level 2, expanding into our spheres. So now our spheres extend to the ends of our hands. And we're still stationary bases, and we can change the orientation so that we can find out how it feels to explore space with our hands out. And with our arms as levers, we're now creating more dynamic movement that our body has to compensate for the destabilization created by the erratic motions that our arms can do. We can mix in some 1, contract in, expand out, throw in some O, contract in again, expand out again. Check in with your mirror balls of perception. Am I breathing? Am I supporting myself with my core and holding myself up? Am I hinging at the hips? Are my feet in a position that best supports my knees? And every time that you practice AIM is going to be completely different. Every time we do it is different, and which is wonderful, because what we're doing is that we're teaching our bodies to be adaptable, because they're not ever able to adapt to the practice that we're giving it, because the practice is always changing. So as the practice is always changing, our bodies continue learning how to be adaptable to change and how to compensate for the motions that we're doing and support our bodies according to the biomechanical design of our bodies, because we recognize what feels comfortable and what doesn't feel comfortable, and we're having fun as we're doing it. And practice every day for at least 5 minutes a day. 5 minutes a day is enough to give your body basic mobilization. If all you can do is 5 minutes, I say spread it out. Do 1 minute 5 times a day, so that you can remind your body throughout the day that it can move in other ways than just sitting in front of a computer or in front of a video game console, or whatever it is that we do for many hours a day of repetitive motion, especially if it's repetitive sitting. And thank you so much. I want to end out with a little bit of shimmy, which is shaking. And shaking our arms. I call these wacky arms. We are consciously kind. We are collectively kind. Wacky arms. And this shimmy here is a way to help our bodies process tension and stress. So if we're feeling stressed out, if we're feeling anxious, we can shake it off, 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 shake it off. Because if we look, we're mammals, and as mammals, shaking physically helps our bodies process tension. Just like animals, like our pets do, they shake it off. So that's beneficial for us to do. And another thing that benefits us is supporting our vagal tone, vagalizing. The vagal nerve runs from the brain through the body into the center. And it's called vagus after vagabond because it travels very far in the body. And it's part of our parasympathetic nervous system, rest and digest. So we can help support vagal nerve tone, which helps support our rest and digest, returning to calm, centered space by laughing, by singing, by humming. So we're gonna do some humming. Hum. Hum. So there we go. If you're only going to do a few minutes of AIM a day, may as well add some vagalizing to it at the same time and really maximize those minutes that you're devoting to giving your body a little bit of self-care, mobilization, elementally intuitive movement. But remember, the more we practice, the better we get. Practice makes better. So the more time that you devote to your AIM, the more you'll train your autopilot to move through space effectively. If you want to learn more focused, then sign up for the 36-week program, full semester, 15% off if you pay all at once, and a new session, new cycle starting every month. Thank you. Have a wonderful day. May your AIM be clear. May your sphere be free for you to be who you be right now.